Hello guys, welcome to my YouTube channel. Today we are going to talk about why thousands of Kenyan women still die while giving birth. Back in 2018, 4 out of every 5 expectant mothers who died in hospital in Kenya were because they received poor care. That's according to the country's first confidential inquiry in maternal deaths. 5 years later, Dr. Edward Serem, head division of reproductive and maternal health, says that that one has not changed. It is true that it's suboptimal care in the sense that skills are lacking in healthcare workers. Availability of commodities and life-saving equipment in Kenya, we haven't attained that, he said. Kenya's maternal mortality rate sits at 355 per 100,000 live births. But plainly, nearly 5,000 women and girls die annually due to pregnancy and childbirth complications in the country. This national average, however, tends to mask a very different entire picture at the country level. Speaking on the sidelines of the International Maternal Newborn Health Conference in Cape Town, South Africa, Dr. Serem says it is a matter of haves and have-nots in countries in the arid and semi-arid regions, bearing the brunt when it comes to maternal deaths. That is a concern raised by Dr. Frederick Kireki Omanwa, president of the Kenya Obstetrical and Gynecological Society, when speaking in Kenya last month. There are some countries where maternal mortality rate is 3,000, 1,500, 1,600 per 100,000 live births. We should actually be taking about this every day. What are they doing about our maternal mortality rates? An easy remedy, according to Dr. Kireki, is getting more health workers on the ground. It came up in countless papers launched at IMNHC, including the Born Too Soon report, and called for an increase in service coverage, improved equality, and addressing workforce gaps. The disparities in service coverage based on One Health in Kenya were glaring, with the report revealing births attended by skilled health personnel ranged from 35% in poorer areas, 92% in the richer regions. These are figures global experts and leaders are looking to improve, not just in Kenya. At the moment, we are at the rate of decline in maternal mortality rate of about 1.3%. We have to be at 11%, doctor. This is said by Dr. Beneji. Kenya's annual rate of decline in maternal mortality rates is slightly better than the global pace, sitting at 3.3%, but it's hardly enough to achieve its target at 140 deaths per 100,000 live births. The average global target is a maternal mortality rate of less than 70% per 100,000 live births by 2030. By current estimates, the reality is more than 60 countries will not meet those reduction targets.